Hello everyone and welcome back. I hope that you are all feeling a little bit refreshed, have had your coffee, have had a chance to network and mingle a little bit. Just from speaking with our panelists a few moments ago, I know that they have already enjoyed a quick catch up. Some haven't seen each other for a while and catching up, of course, down there. I would like to introduce you to the first panel of the day. As you can see, it should be coming up right behind me. It's called Impact of Climate Change on Health. What is the scale of the problem and what action to take? It's a simple title, but I know that the answers and addressing this is not so simple, so I'm going to let our expert panel of guests to tackle this for us, and I'd like to welcome them one-on-one to the stage. First of all, we have Valérie from the University of Lausanne. She's going to take her place over here. Next up, we have Gueladio Cisse from Swiss TPH, the Swiss Tropical and Public Health Institute. Welcome. Following that, we'd like to welcome Neira from the World Health Organization. And last but not least, we have Alfonso from the city of Geneva. Now, this discussion is going to be hosted and moderated by Maximilian Jungmann, and he's from the University of Heidelberg. Just a little bit of housekeeping. I know, Max, you're well versed in this, but we do have 60 minutes for the discussion. You will have some time for Q&A at the very end, so if you have questions, please keep those in mind. When it comes to nearing the end of the 60 minutes, about 5 minutes, I will come back on stage just to give you a little bit of a reminder, and maybe you can take the closing words. But without further ado, I'll hand the floor over to you.
Thank you so much. It is a great pleasure to be here with those very distinguished speakers today, and we are going to talk about a topic that is very relevant: climate change, on the impact of climate change on health. Climate change is a reality. It is no longer just a challenge in the future. It has arrived. It has significant effects on our health. How? That is something that we will discuss now. We will try to contribute to a better understanding of the different pathways climate change is connected to health. We will understand what international organizations such as the World Health Organization are doing to, for instance, support states in adapting to climate change related health risks. And we will be hearing about the city level. What does a city like Geneva, for example, do to protect their population, and also to see how we can break down silos, as we heard in the session before. This will also be a common theme in this session today. Before, the high-level event was addressing One Health. How can we foster inter- and transdisciplinary approaches in terms of health in general? And when we think about climate change and health, it is more important than ever, and in the community, we have been discussing this necessity for years, and we will now start with very distinguished speakers. I believe if I would go through their biographies one-on-one, the session will already be over because they have accomplished so much, and I would rather have the time for the substantive discussion today. And I now invite Gueladio Cisse to give us a first impulse on how climate change relates to health.
Thank you very much. The Ipcc Working Group 2 6 assessment report was released some weeks ago. And among the 18 chapters of the Working Group 2, there is one sectoral chapter titled Health, Well-being, and Changing Structures of Communities. I think this title is not innocent. It's highlighting that health and well-being are very much connected. When you talk about health, people used to think diseases. And if you say make an action plan again for in the health sector, people think it's about diseases. But the WHO, and I'm here with WHO, who will be talking even further about that, is that health is linked to so many determinants of health, environmental and social. And then the pathway through climate to health outcomes, I would say rather health outcomes than health diseases and so on, are through those determinants. It's about the environment where people are living. It's about the vulnerabilities where they are lying on and how they're exposed to those effects. So the IPCC insists in one aspect that the risks on health outcomes, they are based on the overlapping of exposure level, vulnerabilities, how vulnerable you are, and how you are also facing the level of hazard that are. And sometimes these hazards are not coming in a single way, they are compounded. And you can even further, not only compounding pressure on you, affecting your health or your well-being, but they could be coming also in a cascading way. It means something happens in April, something happens again in June, and further lowering down your capacities to cope. So the impact of climate change on health outcomes, I would insist again, not only on diseases, but on the well-being in general, there could be direct impacts. So for instance, if you have a heat wave or you have an extreme event like flooding, some people could die immediately in the 1, 2, 3 days on that event. This is the direct impacts of climate change, extreme events on health outcomes. But it could be direct. It means it could take more than 1 day, more than only 2 days, not over 3 weeks. It's something that is even reducing your capacities, giving more chance to some vectors and pathogens to grow, reducing your infrastructure around you, and then making you more vulnerable, and then affecting in a mid or long term your health and well-being conditions. I hope with this, I'm setting the stage of what we are going to discuss about. Thank you.
Thank you very much. Yes, exactly. This was the first impulse, and we will follow up in the session after we heard from everyone, and then we will open the floor for questions and answers. Now I kindly invite Valérie Dacremont to give some introductory remarks.
So I would really like to bring the point of view of a physician at frontline, so seeing patients in Switzerland, but also working on projects aiming at improving quality of care in Africa. So what I will just tell you is based on what I observe in the field and also on the health indicators that are tracked by the Lancet Countdown in various countries, where we can see if countries manage to do progress or not regarding health, and especially the impact of climate change on health. So it's clear we will have an increase in transmission of many pathogens and also new pathogens. We had a good example recently, obviously. So to start with vector-borne diseases, because we will have a hotter and more humid climate, and this is what mosquito likes to breed. But they don't all like it in the same way. So for the anopheles transmitting malaria, they best like a temperature around 25 degrees, which means that in West Africa, it will become too hot to malaria, and maybe malaria will go down. But in East Africa, it will be the contrary. There will be probably an increase in malaria. And overall, what is expected is that we are losing the benefits we had over the last 20 years. We were so proud of having managed to halve malaria transmission, and now we see, unfortunately, the curve is becoming flat. And even with COVID, there are some resurgence of malaria due to the breakdown of health system. So that's very worrying. We will see if this persist or not, but our improvement, let's say, are not continuing more. For mosquitoes like Aedes transmitting arboviruses, dengue, chikungunya, and Zika, they like a much higher temperature, 30 degrees. So this means that the whole tropical area will have more and more of these diseases with a huge impact, especially in children in Africa, in Asia for dengue. But also it will extend to Europe, to more northern and extreme countries. So we will see probably epidemics in Europe, as we see already in Italy, chikungunya. It's coming, and we might have to one day sleep under bed nets and distribute bed nets in Europe, exactly like we do in Africa. Now we have ticks, we have encephalitis, ticks that transmitted by ticks that is, for example, increasing in Switzerland. We see the number of cases every year that are increasing. But also non-vector-borne diseases like waterborne diseases will also increase due to this flooding and extreme weather. So we know now that some places will become suitable for cholera, like the northeast coast of US, and leptospirosis, also with rats proliferating in urban areas, will become more and more of a problem. But obviously, all these exotic diseases, the first thing that comes to our mind when we think about climate change and health, and that's what journalists like to hear also, because this will frighten people. The first cases of dengue in Switzerland obviously will bring a lot of media coverage probably, but in fact, it's not the main burden. It's not this disease that are the main burden. It's rather the comorbidities. As we see with COVID, it's because we are malnourished, we have diabetes, hypertension, that we die of infectious diseases. And the problem is that climate change will mostly have a huge impact on chronic diseases, like undernutrition and respiratory problems. And that's what we see already in our project in Tanzania, for example, where I work. We look at the determinants for children to have clinical failure. We try at health facility to improve their health, and they fail. And what is determinant of that is, number one, respiratory disease, and number two, undernutrition. And then third is anemia, micronutrient deficiency. And that's what makes these children die from infectious diseases. So obviously with pollution, malnutrition, it will increase. And probably we are supposed, with our project, to improve the health of these children. But we might not succeed because in the meantime, the climate is worsening these chronic condition comorbidities. So we really need a paradigm shift and change our health system and our approach. But I think this we will discuss during next rounds.
Thank you very much. Yes, we indeed need a paradigm shift, and you already addressed journalism, the role of media in this context. And there was recently a comic in a newspaper that showed the different waves of COVID. And then there was one wave covered, and that was a massive wave behind it, and that stated climate change and health. Now, that's a very complex challenge. There is a lot of uncertainty connected to it, and it poses challenges to the international community. Now, what does the World Health Organization do with this challenge? How do you deal with it, and how do you work on the science policy interface as well? Maria, Neira, I really very much look forward to your impulse talk.
Thank you very much, and this is really fantastic to have the opportunity to discuss on a very local context, the global expectations as well, because both needs to be very much hand in hand. Let me be a little bit provocative at least. How many people in the room knows what Ipcc stands for? Come on, yes? What that stands for? Can you say it? Yeah, but it's an acronym, so what do you mean by that? Excellent. Can you tell me what it says on page 26, third paragraph? No? Okay, fine. Good. Anyway, I think that the scientific community, have been putting together on an extraordinary and historical way all the evidence that we have on climate change. As you rightly say, the Ipcc, the latest report, is incredible. It's the weight of the science inside, the weight of evidence that we are putting, the number of scientists that are contributing to that on a very independent way, on the best of their knowledge, telling us things like, be careful, this is the end. If we don't take measures now, this might put at risk almost our civilization. And we don't have a lot of space to start to take action on that and looking at what will represent for our health. What will represent for our health? The evidence is really very, very strong. Essentially, my colleagues already say it, there are three things. The climate change, the global warming, will put at risk the three pillars of our health. What are the pillars of our health? Access to food, access to water, access to shelter, and the capacity, if we can add as well, to breathe clean air. All of these three pillars are at risk because the natural disasters will destroy the capacity to have an agricultural production in certain countries, and therefore we will have a problem with the food production and consumption. We will have problem with access to water because the water will be, the resources and access to water is becoming very difficult, again, because of this global warming. You can imagine that will mean, of course, more diarrheal diseases and malnutrition associated, and it will force people to displace by millions. So again, the shelter that we need. And in addition to that, you can add that the air we need to breathe, the same causes that are responsible for climate change are responsible as well for air pollution. And we have every year 7 million premature deaths caused by exposure to air pollution. So very simple, WHO, well, I'm sure we will have the opportunity to discuss it, but in 2008, we already had a resolution on climate change and health where all ministers of health had signed that they needed to take more action, they needed to elevate that into the political agenda. A few weeks ago at the World Health Day, the theme of this year was Our Planet, Our Health, bringing again the urgency to do something. As health professionals, we need to be mobilized and be the motivation to do much more on climate change. Because if we don't tackle the causes of climate change, we will not be tackling the causes of air pollution. We will not be tackling all of those determinants of our health that are so fundamental, and therefore we will be very, very much at risk. Some journalists, as you mentioned, they will like to ask you, if we don't take action and if we reach and go beyond the 2.5 centigrade degrees, what will be our health? And I say, there is no scenario. We should not even contemplate that scenario. We need to now start to understand that all the actions that we need to take to tackle the causes of climate change, there is nothing else than basic public health actions. We need to stop using fossil fuels, and I think if we needed more reasons now, we have it. We need to stop giving subsidies to fossil fuels that are not contemplating the fact that we are causing a lot of cost for our hospitals because of exposure to the combustion of those fossil fuels. We need to change our cities and our urban planning and making it more for the citizens, for the health of our citizens. We need to transform the way we generate energy, and we do it with renewable, clean sources, and we need to stop polluting everything we touch. We pollute the water we drink, we pollute the food we eat, and we pollute the air we breathe. Look at the oceans, they are now full of millions of tons of plastics, of pollution. After all, that will end in our bodies. We pollute the air we breathe with all those toxics that end up in our lungs. And we pollute what we produce with our food using intensive agricultural practices, deforesting, and putting fertilizers where not needed, and again, producing plastic and all of this pollution. Moderator, I will stop here, but I'm sure that this will generate, I hope, some discussion, and we will have more opportunity to go back to the strategic lines of what we plan to do on addressing climate change and health. Thank you.
Thank you so much. What an inspiring and insightful introduction. And as you can see, we want to facilitate the session in a way that it is most interesting and interactive, exciting for you. And that's why we will also open the floor for questions and answers later on. Now, you mentioned the different levels of governance that need to come together. One central area where it comes together is cities. Cities is where we can feel the consequences of climate change in terms of heat, the urban heat island effect, for example, and also many of the other health risks that you addressed before. Now, I invite Alfonso Gomez to give us some insights into the city level. What can cities do to both decarbonize, transform, as Maria said, but also to adapt and to protect their populations of climate change-related health risks.
Merci, je veux me permettre de parler en français, je crois que vous avez...
Thank you. If I may, I will speak French since you have interpreters. My first reaction would be like, well, here we are. Because 20 years ago, I remember the scientific community was already saying if we don't do anything, world temperatures will grow by 2 degrees. This is no more topical today. We know that regardless of what we do, temperatures will go up by 1.5, even 2 degrees higher. And this is where we are going to feel the impact in terms of public health, and mostly in cities. This is where it starts, because in cities you have high density of population, and about 2/3 of the world population is bound to live in cities. And so in Geneva, we've worked on a climate strategy, and the first track is to reduce the pollution of the production of CO2, our own production, but also the CO2 import through the reduction of our CO2 production. We have very ambitious goals in that field. By 2050, the objective is to reduce that production by 50%, and the objective by 2050 is to have no CO2 emissions, although it's impossible because we'll always be releasing CO2, but we're hoping that the environment will be able to absorb some of it. In concrete terms, it means that in Geneva, every year we release 13 tons of CO2 per head, which is huge. We have to reduce this. We have to use cars far less, for instance. The second pillar of our strategy is that, as I said, world temperatures will increase by up to 2 degrees. So what are we going to do to increase our resilience for those that are the most vulnerable, either because of social health factors? And I'll give you an example, and we will see an increase in terms of inequities in low-income neighborhoods, where we know that these people, there are fewer trees in these neighborhoods, for instance, but wealthier neighborhoods like Champel have up to 30% of trees covering, and the Paki neighborhood, a low-income neighborhood, only has 6% of its surface area covered by trees. And so 20 years ago, when the scientific committee said if you don't take measures now, we'll have to take them in 2020, 2025, and it will cost you billions. Well, here we are. We do have to take measures that are going to be very costly. I could give you more measures. What are we doing? We're planting trees. The goal is to cover 25% of the city with trees by 2030. And this is very important. We know those trees play such a crucial role in terms of biodiversity, but also keeping temperatures to a lower level. We have to refresh the city. The objective is also to have a paradigm change. During the first heat wave, the message was to tell the elderly, stay home. And we've seen what happened with COVID. It had an impact on their health. You tell people, stay home. We know it had an impact. Our objective is to stay the opposite. When there is a heat wave, don't stay home. But we need to make sure the conditions are there so people can be outside and have a social life. We don't want to isolate people, which could have a disastrous impact on these people's lives. A recent study called Urba Confort was recently published. We've been working with universities trying to see what the conditions are for temperature increase or not, and what we can do. So it can be the materials we choose when building housing. We know, for instance, when picking glass, that it will reflect sun rays, for instance, and have an impact on temperatures. The circulation of air in some of these buildings and in some of these neighborhoods on streets, so we can make sure people can remain cool or cooler when they're outside. I could go on and on. As I said before, we are now focusing on investing. The city of Geneva has increased its investment by 50% because the emergency is here. We need to take actions. I think we might have to increase even more. We have to invest more. We've been talking about 130 million every year in the past, and today we're spending 180 million francs. And I think we'll have to increase these investments. There are other measures that we're trying to adopt and change people's behaviors, which are the results of political decisions. For instance, what is the role of the city in consumer behavior? And we are trying to do our best so that people can buy in a sustainable way. The use of cars also is a problem in terms of CO2 emission, but also has an impact on our health. Everybody knows this. We know that when it's very hot, we can see that it is imperative that we stop cars from driving in town. And so there are a whole array of measures that will require great political will, because regardless of political differences, it's a matter of public health. Back in the days, you know, I belong to a political party that's been sounding the alarm for a long time. And I'm glad to see that more and more people are convinced by this urgency, and more political leaders are aware of this. But now the question is, what are the actions we're willing to take? What are the sacrifices we're willing to make? At some point, as I said, we'll have to invest heavily. Local authorities have a crucial role to play. We've seen it with COVID-19. Local authorities must play their role, but there are also ideological differences, and it is important that we do our best not to reduce these investments. The debate is very heated in Switzerland in terms of reducing tax, for instance. And so we must reach a consensus so we understand what the goal is. I could also share with you more specific actions in terms of food, the use of public spaces, but this is what I'm going to start with. Thank you.
Thank you very much. Thank you very much for this very comprehensive overview as well of how you can come from strategies to specific implementation and how climate change can be mainstreamed in city planning, urban development, for example. Now, for this session, we have to find some key questions that we want to answer together with you, and they focus on certain dimensions. One is, what is our understanding of the nexus between climate change and health? What also needs to change to contribute to an even better understanding? Where are there uncertainties? And how can that be translated into actions? How can sustainable adaptation to climate change-related health risks also look like? What does that mean for different actors? And how can mitigation, so addressing the roots of climate change, reducing greenhouse gas emissions, and adaptation, responding to climate change that's already going on, how can that go hand in hand? Where are there synergies? Where are there potential trade-offs? In terms of the first question, how do climate change and health relate? We already had some great introductory remarks in the beginning. Now, my first question to both of you, Gueladio and Valérie, is what does that mean for the scientific community? There is still uncertainty. There is much more knowledge about the nexus between climate change and health than there used to be. But there are also many aspects that we don't know yet. Maybe there are unknown unknowns. And we talked about the change in the academic community in terms of transitioning to One Health approaches, inter and transdisciplinary is supported. What does that mean in our day-to-day lives? What needs to change in terms of funding, in terms of actual collaboration? So Gueladio, maybe you wanted to start with that.
Thank you very much for the question. I think for sure science is like a river flowing continuously, and after you discover something, there is more to know. And in the landscape of understanding these linkages between climate change and health conditions or health outcomes, you have two sides of exploration. The first is already what we are observing. So I think this is one important point, and the structure of the chapter of the Ipcc is highlighting this, that climate change is not only about the future. Many people could think that it's the projections that are more worryable, and it's the future that is more worryable. But we're already in places where the worry is already there. And what we are fearing that much larger regions or many more people will be facing is already lived by some people. So understanding the observed impacts already is the first area of challenges. And what is appearing is that some places where the impacts are even worse are where we are still having a gap on knowledge of the real extension or real impact of that, because research is stronger in wealthier countries, and then teams in some countries, when even the extreme event happen, are not so strong to really be able to monitor and really document and find for the scientific community how things are going on. But we are more and more, years after year and decades after decades, having more and more evidence coming from the literature on the observed impact of climate change on many, many variables, ranging from the transmissible diseases, and Valérie has already touched the infectious disease group, but we have all the chronic diseases, all what is non-transmissible, non-communicable diseases, and many conditions like chronic diseases, people holders, cardiovascular diseases, diabetes, and so on. We have more and more evidence on those impacts as they happen. And mental health is coming strongly now on the literature. That was not the case before. After extreme events, there is more and more evidence on how it is increasing the number of mental health issues. So this is one range. And on that domain, we have also a number of challenges around the social determinants, how they play, how they are playing. So it's not only about measuring natural things or insects or vectors, it's about also how people in their different variety of cultural setup capacities are facing those things. And then you have the projection. Projection is also where you have some skeptical discussions or some people saying that it's like a catastrophic scenarios of movies. But we have more and more strong teams still with that, inequity in capacities of undertaking such studies between developed countries and developing countries. But I think we are in an interconnected world, and scientific world is much more connected in partnership programs. We have more and more strong evidence on projections related to some diseases. So we have very clear idea, for instance, on the excess death that could be expected in mid or long term on some health outcomes and variables. And this is what I could say for the moment. The challenge is still there, that we have still some uncertainties around those projections. We have still some links that are not yet significantly covered, but we are progressing, and in a scientific interconnected world, we are becoming more and more stronger in doing projections.
If I may, one very quick follow-up question, because we have the privilege of having someone here with us who is involved in the Ipcc process. And Maria asked in the beginning how many of you know the Ipcc. Surprisingly, many of you know the Ipcc, which is great news. But how does the Ipcc work? If you can give us that in a nutshell, because it's a different process than other scientific avenues that we're following. Can other areas learn from that as well?
The International Panel on Climate Change has been set up by World Meteorological Organization and United Nations Environmental Program, and also supported by all the UN system, including WHO, in 1989. And it worked for many years, putting together the evidence coming from the scientific world in a neutral and positive way. It's not oriented in ideological way or political way, to be prescriptive. It's just the compilation of scientific knowledge around the world and how this knowledge is going together in the same direction or not. That's why you see this mention of level of confidence. If it's such strong, it means that many results are going the same direction. And when in the table we are still on some studies finding a trend that is different from the others, then we have this grading down of the evidence, saying high level or mid-level or something like that. But it's really the largest scientific committee selected all around the world. For instance, the past round has gathered more than 260 authors together, and this is not counting even more than 400 other contributing authors around the world. And as I said, there are several chapters, and for the health chapter, for instance, it's a matter of trying to find where the evidence is and how this evidence is strong or not. And there's one thing that I would like to mention. It's the Ipcc report that are from the last, say, I don't know how many years, influencing the international agenda, in fact. 10 years after the Ipcc creation is where we came to all these conventions that are much more now acknowledging the adaptation importance, the mitigation, the Paris Agreement. If you look at the timeline of the Ipcc report release, they are so tied with the main international convention meetings. For instance, the second last Ipcc report in 2014 is the one that helped a lot to support the discussions in the Paris Agreement in 2015. And we are also looking forward with this report that has been released now. In 2023, we are looking forward to the next Stocktake conference after the Paris Agreement to know where people are standing and how this evidence will also helping the people. So I don't know if I responded very well to your question. It's a really an amazing, and they got the Nobel Prize. This is something that I should say. 10 years after their creation, they have been rewarded the Nobel Prize at the same time as the Vice President Al Gore. And it was recognizing how they helped the world to better understand the linkages between climate change and health, and also how not only showing the risks, but how they are also giving the foundations for the responses that international world should be giving. So that's what I would say about Ipcc. It's a Nobel Prize winner that we are talking about. Thank you.
I'm glad you mentioned that because it is really unique as well to have this. Now, I want to give the floor to Valérie, and if you want to add something to the first question, what does this mean for the academic community? Is it changing? Does it need to change? And then the second question, in preparation of this meeting, we discussed the different challenges for different regions in the world, and we were discussing about the situation in Switzerland, for example. But if we think about the most vulnerable nations in the world and vulnerable people, that is in the global south. What does climate change and health mean, especially for the global south?
Okay, thank you very much. I think we have been observing a lot in climate. For many years, scientists have brought a lot of facts. Now we have all the numbers, we know what we should do, so now we have to intervene. So I think we should do operational research in the field and monitor the impact of what we do and not wait again to only observe. And here, in fact, we were with health system and the way we do care, we were already in a non-sustainable situation before even the climate problem came in. In northern countries, our health system could not continue like that to focus only on curative care because the prices are going up, the population is getting older, and we will not manage. So we need a paradigm shift to go to prevention. If we take the example of COVID-19, it's nice to have preparedness plans, but the problem is that another bug will come that we don't know. We will not be prepared much. We have to do prevention here. So to prevent on the bug side, that means stop destroying nature and stop exploiting animals. But on the human side, we should prepare ourselves by being in a better health. And that means if during the COVID epidemic we would have put people doing sport, controlling hypertension, losing weight, we would be much better off. But during a crisis, it's too late. So we have to absolutely do that before and have this shift really now to preventive care. And that's true for northern countries, but also for southern countries. And we can learn a lot from southern countries who, for pragmatic reasons, were forced to put a lot of resources in prevention, which is really good. And we can really learn now also in the north how to do that. And as you said, Maria, because we have to work on this determinant of water, air, and soil, food. So also in the clinical practice for physicians taking care of patients, I think they have now to bring that in the discussion with their patient and not just ask them, okay, you have a bit of cholesterol, here is a pill, but what can we do now to have you losing weight, having healthier food, can you go by bicycle to work, etc. So that's also bringing the prevention in the core of the consultation with the patient. That's absolutely essential, both on the health system side to have a shift and within the care system.
Excellent, thank you so much. You already gave the perfect transition. What can we do? That we generate a lot of knowledge on what needs to be done, and then it needs to be translated into practice. And we highlighted the role of the Ipcc. I think it is important to highlight the role of the WHO as well, because it has been at the forefront of the discourse on climate change and health from the beginning on. If you look at which publications are cited, what is received by decision makers, the WHO is always at the forefront. Now, my question is, what can we learn from the challenges and opportunities along the way? How can other sectors learn from this? And what do you envision as well for the future? How does the discourse on climate change and health need to change?
Thank you. Let me start with the discourse, the narrative. I think is fundamental. You heard it from a participant of the Ipcc. It's the biggest scientific body ever. And they are independent. I think that word is very important as well to strengthen and to reinforce. Now, the recommendations of the Ipcc, they need to be translated into policy recommendations. And this is what the COP should be about it. I mean, the conference of the parties, you have member states. As you well know, last year it was COP26. You know what that means? It means that for 26 years, 26 years, the countries have been negotiating about what to do on climate change. So my question is to all of us as a society, are we taking the weight, the strong message that we are receiving from the Ipcc and translating it into the policy recommendations at the level of ambition and speed that will require? I'm afraid the answer is no. No. That's why WHO has always been attending the COPs, from the first one to last year, with the health argument, what we call the health argument, because we think that the health of the people can be the driving force, the engine to further motivate action on climate change. Means, if you tell people that climate change is about their health, not just to the health of the planet, not just polar bears, not just glaciers melting, which is all true, but if we put a human face on it and you tell people, listen, this is very much linked to infectious diseases, to vector-borne diseases, to malnutrition, to diarrhea, to chronic diseases, to the pollution of the air we breathe, the asthma of our kids. That was a magic wall. The moment we link it, air pollution with asthma, pop, people realize, okay, I understand now the connections. Because it's very difficult for the general population to understand the linkages between climate change and health. But it's very, very easy for them to understand, well, if the air I'm breathing is polluted and toxic, my kid who has an under condition as like asthma will have an episode of respiratory diseases. And you know, that was when we started to put and change the narrative in WHO. We are now giving the positive arguments. Of course, we say climate change is very bad for your health and you need to adapt because it's already happening. However, if you take actions to mitigate the causes of climate change, the health benefits that you will obtain are enormous. If you reduce the use of fossil fuels, I mean, if you stop the combustion of fossil fuels, you will have enormous benefits for health on the reduction of the 7 million premature deaths, on the reduction of all of those chronic respiratory diseases, cognitive development stoppage. Your colleagues on the health systems, they are already spending a lot of money on climate change and they don't know it. So that's part of the health and economic arguments. The second enormous health benefits you will obtain if you go for a more sustainable food production, consumption, and waste management, you will have healthy diets. You will reduce enormously the cost on obesity and all the sedentary related diseases and non-communicable diseases. And the third enormous benefit will come from better urban planning and land use, because then you will have a more sedentary lifestyle, preventing, as you rightly say, all of those diseases caused by exposure to air pollution, by the fact that you are sedentary. So we are putting now the discourse in positive. Implementing the Paris Treaty is nothing else than the biggest public health treaty ever. If we implemented the Paris Treaty, the public health community, I think we will be the happiest ever, because this is primary prevention. This is the real primary prevention. The implementation of the Paris Treaty, there is nothing else than common sense, wise approach, is a One Health, is primary prevention, is putting the people living in cities where their health not only will be protected, it's simply they will not be at risk because they can walk, they can have physical activity, they are not breathing toxics, and as you rightly say, if we have a problem, we should not put all the responsibility on the citizens. There is a heat wave in Geneva, stay at home. No, no. We need to make sure that people will be, if there is air pollution, don't walk in that area because it's polluted, or wear a mask. No, clean the air for me. It's your responsibility. We need to have sustainable public transport, and that will create a different urban environment, and that will be at the core of a better, more well-being and health promotion. And the trades-off in terms of money are amazing. All the subsidies that we are giving now as governments, the governments are giving to fossil fuels, the price of that represents 60 million every second that you are giving to subsidies on fossil fuels, while then the health system globally is paying 5 trillion to cope with those diseases created by exposure to the combustion of fossil fuels. So if we do it on a holistic base, this is the most public health, common sense, wise primary prevention approach that we can ever have. But we need to use the health argument to motivate action, to convince people to move from the apocalyptic messages that will paralyze the people and they are not prepared after the pandemic, on something stimulating, positive, and telling people what can they do to fight and to vote for political parties that will be doing much more on stop destroying nature and being a little bit more ecological and protecting our ecosystems and our nature.
Thank you so much. That was very actionable and exactly what needs to be done. We can also see that there has been some progress in the role of the WHO at the COP, for example, in Glasgow, COP26 was very strong. For the first time ever, health was mentioned in the outcome document. So there is progress, and it's a lot about knowledge, it's a lot about learning and then translating that into action. And we talked about the city level. Cities are at the forefront of climate change, of health, and it goes hand in hand. There are opportunities for cities to also learn from each other. We have city networks like the C40, the Global Covenant of Mayors, and other networks. Can you give us some insights on how cities also support each other and how you mainstream climate change across the different dimensions within city governments, how you build capacities, because it requires so much knowledge. And we need to come to a point where everyone has this actionable knowledge, this transfer knowledge. And I'm very curious to see how this works. If you could keep it rather short, I know it's a very difficult question, but if you can keep it short, then we can open the floor for some questions from the audience as well. Thank you.
Well, as I said earlier, cities have a key role to play, and in this respect, states now have a forum, and there's still a lot of road to cover for the experience of cities to be reproduced here, there, or everywhere. It's sometimes difficult because the contexts are somewhat different. Nevertheless, it is through cities that you can find a certain number of agreements, more particularly in their specific role, which is a direct contact with the citizen. You can see, in practical terms, the impact of automobile traffic on the citizen, city pollution, as we can see, very direct. When it's at a higher level, you find other interests that come into play. The interests of health are often in contradiction to commercial interests, and that is why a certain number of measures take a certain time to be implemented. Asbestos is very significant, and there's still some areas where legal procedures are undertaken to ban the use of asbestos. So cities have a key role to play through their proximity with the causes of pollution and of climate change on its own inhabitants. And here these fora, which still exist today, are at their beginning because they should be given more significant decision-making powers to cities, and the leeway of cities in relation to the issues, I think, is quite insufficient. A practical example, if the city of Geneva in heat waves, certain roads would be closed, but other interests say that the roads are maintained open. I can be aware that you need to discuss with all partners concerned, but there comes a time when you should ask the question of knowing whether the authority of taking decisions shouldn't be closer to the citizen. It is also cities which, as I said earlier, take very practical measures to increase resilience. These examples are not sufficiently distributed or circulated. I personally feel that this is a field where we have a great deal of progress still to be made of how cities can be interconnected and can take decisions amongst themselves without necessarily waiting for major conferences or high-level government decisions. I also feel, which I see in a certain number of cities in Switzerland, collaboration between cities and the scientific world needs to be increased. But here again, there is major activity to be undertaken.
As you can see, time is running out, and it's a perfect analogy with climate change. We have to act now. And unfortunately, we didn't have the time to ask for questions from the audience, but I'm sure we can continue the discussion in future events and also as a follow-up of this. Thank you so much.
I promised Maximilian and the panelists that I would come up for the last 5 minutes. So actually, you are in luck if you want to take the last 5 minutes and open up the floor to maybe one Q&A. No pressure. Well, someone's already very eager. But the challenge then for the panelists, whoever answers, is to keep it very, very succinct. So 3 minutes, I would say.
Yes. And if you can keep it, please, very short and also directed to the person.
UNFCCC, sorry, it's international organization, it's secretariat of the UN, and it is not part of ECOSOC. The other international organization are member of ECOSOC, which is member of General Assembly, like UNFCCC. Since the UN General Assembly decreed that all the UN agencies should adopt a climate change program, and some they adopt at the beginning of 2000. But public health mandate is WHO mandate, and the WHO adopted climate change program until 2013. Anyway, what I want to raise, yes, about public health, urban health, healthcare, which is Anglo-Saxon perceptions. But nowadays, yeah, you said Ipcc, which is Nobel Prize also with somebody, and IPBS, another structure of CBD. My question, now I want to raise something about cities, because it's very important, and the COP, and UNFCCCs, and 26 years negotiation, not like the others, because when Kyoto Protocol entry in force, we are negotiated another step. How? Over mediatization. Because the US ratification was not useful anymore. And nowadays, another step of negotiations, because the copy of this more than 20,000 delegates, 30,000 delegates. Last time in Heidelberg, there was many CEO companies, and next time in Sharm el-Sheikh in Egypt, which is a good opportunity for fishing undersea, submarine, there is another opportunity for mayors of cities to attend that. Geneva cities administrated more than 7 network of cities since more than 15 years ago. And recently, Geneva city setting up another success story, which is Geneva Cities Hub, following Geneva Health Forum success story. And the head of Geneva Cities Hub is the former mayor of Geneva Cities. But my question about services, yes. UNFCCC, as you said, is located underground of WMO building. And WMO, they have also their own services, climate services. Nowadays, how we wish health services in Sahel, how we wish health services in Ireland, how we service health services in those Languedoc cities. I stop here. Thank you very much.
Thank you. I think Maria Neira is the one who could answer this question, but also Gueladio.
I wanted to rather end up, because it's short, on one general statement that is maybe encompassing what the colleague is saying. I think the challenge in hand now is how to ensure that all the knowledge gathered at different levels, be it by international organization, by national organization, by indigenous people and so on, are better taken together. And the second thing is this science and policy dialogue. Yesterday, I was in Bern. For the first time forever, the Parliament of Switzerland invited all the scientists based in Switzerland who contributed to the Ipcc report and the IP-based reports, where more than 20 people received, you get the honor to be received within the Parliament of Switzerland and with the President of the Parliament, with one federal councillor in the room and several national councillors in the room, for the first time listening to the scientists. For me, this is something that I wanted to state here, that is the way forward, how we can ensure creative ideas of platforms that will bring together all the sources of knowledge with the policy actors. So the last point is, we said we need that health sector adapt. But it's not only health sector to adapt, but how the other sector will adapt for health. And this interconnection is very important to state also before the end of this session. Thank you very much from my side.
So I'm going to jump in here. I think that the question, we have a lunch break after, of course. You can find any of the experts, and I think this will carry on for more than just the minute that we had for that. To all of our audience, don't go anywhere, because if you haven't actually noticed, right behind you, we have prepared for the very next interview. And all you have to do is just swivel your chairs. Don't have to do anything. Maybe have a stretch. And then Ariane Alcorta will be leading that conversation for now. Thank you very much.
Thank you.